Patient has heart failure with an ejection fraction of 55%. Which of the following is most strongly associated with this patient's condition? Now, this patient has heart failure with preserved ejection fraction. This most commonly occurs due to a diastolic dysfunction. And the diastolic dysfunction is most commonly going to occur due to systemic hypertension for a long period of time. Now, if we have hypertension, then it is going to be harder for the ventricle to eject blood out of the ventricle. So the afterload is going to be increased. As a result, the answer choice is going to be choice B, which is increased left ventricular afterload. Remember, afterload is the amount of pressure the heart needs to eject blood. Now, here we have these images that might help us visualize what is going on. So if we have hypertension, then the left ventricle is going to need higher pressure in order to eject blood. Remember, blood is going to travel from areas of high pressure to areas of low pressure. So if we have high pressures outside, then the left ventricle is going to need even a higher pressure in order to eject blood. So over time, the heart is going to undergo something called concentric hypertrophy with hypertension. This concentric hypertrophy is going to make the ventricle more stiff and more rigid, and this is going to allow less filling of the left ventricle. So the volume within the left ventricle is going to decrease. And we can see that in this pressure volume graph, where if you take a look at number one, it represents the end of diastole. So this is going to be showing us the left ventricular and diastolic volume. And we see that the end diastolic volume is going to decrease. We see that the pressure is increasing. And so again, heart failure with preserved ejection fraction is going to be due to a diastolic dysfunction, and most commonly this diastolic dysfunction occurs in the setting of a prolonged systemic hypertension.